Hello everyone, and welcome back to the Guidewell Connect Insights Lounge. We're here at day 2 of the AHIP Institute and Expo. Everyone, my name is Kate Warnock, and I have 2 new guests here with us in the Insights Lounge. Gentlemen, welcome to the interview.
Thank you.
Good morning.
We have Mr. Bob Smoley. Bob, you are the Chief Strategist for MedicFP, and we have Wendell Elms, you're the CEO.
Correct.
All right, well gentlemen, we're so glad to have you today. You represent a really interesting company. We haven't had this perspective shared yet on stage, so I'm really glad to have you. Bob, we're going to start with you. Tell us more about MedicFP and how it protects against healthcare fraud, waste, and abuse.
Well, thank you for having us, and good morning. MedicFP is a unique company in the United States. We have created a technology unlike any other. We prevent healthcare fraud at the point of care. As a patient presents themselves, we check them in wherever they go for health care. We identify them to a certainty, and once we are sure who they are, we then biometrically enroll them with the Fujitsu palm vein scanner. And at that point, we eliminate all identity theft, identity sharing, and more importantly, our vision is to eliminate phantom billing in the healthcare arena. So we will eliminate, to a certainty, theft, identity theft sharing, and phantom billing. Phantom billing represents about 40% of the healthcare fraud problem in our country. And in all iterations, either in brick and mortar, in home healthcare, and in the delivery of durable medical equipment, we will eliminate all of that fraud.
So Bob, I think, in talking with you just for a moment yesterday, you were sharing how your technology, as you mentioned, it captures it right at that point of care. So instead of that 30-day after the fact, now we have to reconstruct what may have happened, you're saying that you're able to identify with certainty an individual when they arrive, maybe in a doctor's office, at a clinic. You were even saying if it's a televisit,
That's correct.
Through a mobile device. Why don't you tell us a little bit more exactly how that works?
Well, we have access to government photographic databases. So when a patient arrives either through telemedicine or through a brick and mortar scenario or at their home, we can identify them to make sure they are who they say they are. Because the payers obviously want to make sure that the expenses that they're covering are for the people who are members within their organization.
Sure.
So we ensure that that takes place. But in that same process, we also know that the patient was physically present at that point of care. And once we can identify and provide the payer with the knowledge that the patient was present, then that eliminates all phantom billing. Because if we have not checked them in and scanned their palm, we say no palm, no pay. Because clearly if they get claims where we're not checking that patient in and taking their palm scan, they weren't present, they weren't there. Hence, phantom billing.
Right.
And it's such a large amount of the fraud, we save the payers that money. Unlike the technology that exists and has existed for years, which is they've called pay and chase.
Right.
And as you just alluded to, it's after the fact, the crime's been committed, the money 90% of the time has already been expended, and the recovery rate in the United States of America today is 1.39%, where the fraud that we prevent is close to 50%.
Okay.
So just imagine the economics of the payers not dispersing that money and spending years investigating and chasing it. The money never leaves their corporate treasury. Right. And that's a tremendous savings.
Wendell, why don't you share with us kind of the state of the nation right now for this kind of theft? What is the reality of fraud, waste, and abuse in the healthcare industry today?
So the reality is it's an enormous problem that faces our country. The overall healthcare expenditures is around $3 trillion annually, and it's estimated that roughly 10% of that $3 trillion is attributed to healthcare fraud. So as Bob just alluded to, what MedicFP is focusing on is how do we address that problem that continues to grow year over year with very little recovery, as we just talked about. So the problem with phantom billing and the identity theft continues to grow. If you look at the growth year over year, our country is going to be looking, I believe, by 2017, 2018, fraud approaching $400 billion in this country. So the solutions that are out there currently to address the problem is certainly not addressing the problem. The only way to address this growing problem that this country faces and we as taxpayers face is to stop it before it happens at the point of care.
Right. All right, so final question for you then, Bob. Let's have you answer this. You know, you alluded to this massive waste that we're looking at in the next several years. It just proves that cyber thieves never sleep. They continue to outsmart, outwit the current protections that are in place. What is MedicFP going to do to iterate to make sure that they stay one step ahead?
Well, you're 100% right. And as you note, and we read it in the news all the time, that a lot of our payers and other databases are being hacked.
Right.
And that we have now over 100 million patient records that are in the black market. That's 1 in every 3 Americans have already had their IDs accessed through these hackers, mostly outside of the country. And they're doing that to attack our healthcare system in our country. So the good news is that MedicFP will eliminate that fraud, because those hackers are acquiring that information to fake identities to allow identity theft and phantom billing. So our software will actually address that. But as you noted, fraud never gets eliminated. The nature of fraud is it just morphs into other areas, it moves, trying to stay ahead of the technology to prevent it. Well, unique to MedicFP is that we actually are ahead of them. And we will stay ahead of them because we're creating technologies. Since we do a significant amount of research to understand how the fraud is perpetrated, you have to know how they do it before you can prevent it. And again, we're not investigating it to chase after it, we need to prevent it. So we are ahead of them. We are staying ahead of them. We have research teams, we have developers on staff working full-time for us under our own roof. And we are creating the new technologies, as you indicated before, with telemedicine. We understand that space as well, and that is ripe for fraud because it's virtual.
Right.
The patient's not even going into a brick and mortar office, and we've developed those technologies as well. So we are, for once in this country, ahead of the fraudsters, and MedicFP will remain ahead of them.
Well, I'll tell you, gentlemen, I know working for a large health plan back in Florida that this certainly is probably the biggest issue that keeps our executives awake at night. So I'm glad to hear that there's a solution that might let them sleep a little bit more easily, as well as the consumers who obviously want to keep their most vital information protected. So, gentlemen, thank you again for joining us here today at the Dial Connect Insights Lounge. My name is Kate Warnock. We're going to be up soon in just a moment. Please keep watching.
Thank you.